How's that? Can everybody see it now? Better. Okay, good. Good deal. So in ICD-10, the category or the family name, which is the first 3 digits of the code, will always reference the chapter from the tabular list of diseases and injuries. And one of the things that I would like you all to do is when you leave today and you go back to your offices or you come back to the office on Monday, is start looking at your ICD-9 code book and look at the chapters that you would predominantly use in your particular healthcare discipline. Now, we have a number of different healthcare disciplines, and it's been very, very interesting for me because I've been out teaching with an organization called Practice Management Institute. I'm on the faculty there, and they have us out teaching all over the country. And so I'm actually teaching at hospitals, ICD-10 coding. And when I get into a classroom, I'm in a classroom with, for instance, the last time I was in class, I had a birthing center, an orthopedic clinic, a dermatology clinic, and a pain management clinic, and one family practice. Okay, and they're all having to learn this just like we are, and everybody has the same issues. So I don't want any of you to feel like you're an island out there. We're all learning ICD-10 from scratch together. Okay. So remember that the category or the family name, which is what we refer to in the first 3 digits, will always reference the chapter from the tabular list of diseases and injuries. And the question is what chapters will you, your clinic or doctor, be using the most? And learn those chapters, at least learn which chapter they are in. Now again, within the chapter, you're going to have thousands of codes, but you're not going to have to learn all of them. You're going to need to learn basically your top 25 to 50 codes and the mapping of those codes. And we'll be working on that next week. Okay. Okay, so the format a little bit bigger here. This gives you your category or your family, what we call your family name. The 4th, 5th, and 6th digits give the etiology, the anatomic site, and the severity of the condition, and then the 7th digit is the extension. Now, the question always comes up in the ICD-10 coding classes is, will we be coding to the 7th digit on every encounter, or does every diagnosis have 7 digits? And the answer is no. Just the same way ICD-9 doesn't always go out to the 5th digit. Sometimes it's 3. Most of the time it's either 4 or 5. In the ICD-10 coding format, most of your codes you're going to find to be between 4 and 5 digits. Okay, maybe 6. The 7th digit extension is only used in certain situations. So don't feel like you're going to be having to worry about coding all the way out to the 7th digit unless it's warranted. Okay? Let's look at some examples of how specific ICD-10 codes are now and how specific they are going to be. I'm going to use this as an example because we do have a number of chiropractic clinics on this call today. We all have a favorite ICD-9 code called sciatica. It's a very common condition that's treated by chiropractors, physical therapists, and there is one ICD-9 code for sciatica, which is 724.3. The level of specificity of sciatica now has expanded that code to 7 codes. So if, for example, as I was mentioning, if you have a practice management software program and it has a mapping tool, and you were to put sciatica in to that mapping tool, you would get this code, M54.3, because that is the same code. However, as you'll see, there are 6 different codes underneath that are more specific. What that means is that the less specific code will not be approved for billing. And that is a very, very standard coding rule. The coding rule is if there is a more specific code, you use the more specific code. okay, which means that now that that is coded out to the fifth digit, okay, in the case of this particular code, sciatica. So these are your codes now. You have sciatica of an unspecified side, you have sciatica on the right, sciatica on the left, sciatica with lumbago, on the unspecified right side or left side. And so, as I was mentioning, this is also now considered, for instance, sciatica with lumbago is now considered a combination code. Because for those of you who know, sometimes we have to code sciatica and then have an additional code for lumbago. And we don't have to do that anymore. It is a combination code. But you need to know that so that you can correctly code the sciatica diagnosis. If you were to put sciatica right side and then code lumbago as well, because there is an ICD code for lumbago, that would not be an appropriate coding set because now there is a combination code that you can use. Okay, that's just one example. Let's talk about, we have some behavioral health folks here on the call. We have ICD-9 code for attention deficit disorder. There are two codes, in essence, for that condition, which is ADD without hyperactivity and ADD with. Now, ooh, that's a good transition. Okay, hold on, one more. We have ICD-10, which now has broken that down into 5 codes as opposed to 2. So this shows you how the code set has expanded. Just to give you some more examples of the code set, of the expansion of the code set, we have hypertension codes now have gone from 93 possibilities for different types of hypertension and combinations of hypertension to 138 in ICD-10. Fractures, okay, there are 13 categories of fractures in ICD-9, has increased to 287. In pregnancy, 75 plus possibilities in ICD-9, we're at 275 in ICD-10. So the code expansion is tremendous, okay? Let's talk about that 7th digit extension a little bit. The 7th character code extension have primarily been added for injuries and what they call external causes. The 3 main 7th character codes that we're going to see, unless we are an orthopedic clinic, okay, are A, D, and S. A stands for the initial encounter, D stands for the subsequent encounter, and S stands for sequelae, which is a late effect. For example, the treatment of a scar as a result of a burn, okay? So if you have a diagnosis code of a keloid scar, you're going to have to code that with the S extension as a late effect as a result of some type of a condition, okay? So here's an example of a code that is placed out to the highest level of specificity. So basically, this is the code for a major laceration of the thoracic aorta initial encounter. So the A is telling the insurance carrier that this is the initial encounter. Now, I do want to caution you, initial encounter does not mean initial visit. It means the initial encounter or treatment of that disease or that condition. So for physical therapists, for example, if you are have a patient on a physical therapy program and it is for active care, then you are going to use that A extension where indicated. And especially if you're treating a patient for, for physical therapy as a result of an injury. Okay, so that's going to be very common in physical therapy. It will also be fairly common in chiropractic. When we're dealing with auto cases, for instance, whether we are dealing with an initial encounter or we're just dealing with a basic follow-up visit as a subsequent encounter. A good example of a subsequent encounter would be if the patient is treated for a broken leg, okay, and they are, throughout the course of that treatment of the broken leg, they're having maybe x-rays done and they're having physical therapy done. That is all part of the initial encounter. But when they have to come for just a cast removal, that's going to be a subsequent encounter. If it's just a routine checkup, okay? The placeholder, here is your placeholder, is used to fill in any missing characters when a seventh character extension is required for the code. So, for example, if I take the X and the A out, the highest level of specificity for the code of the major laceration of the thoracic aorta, this is the S25.02, okay? And then they want the initial visit. Well, this is not coded out to the 6th digit. It's only coded out to the 7th digit. I'm sorry, to the 5th digit. But they're asking for a 7th digit extension. So if we put that A on the 6th digit, that's not correct. So we have to put the placeholder in to create that 7th digit extension for that particular code. And again, if you have questions, just go ahead and save them up, and I'll be opening this up for questions toward the end of the class. The fracture codes have gotten very, very specific. So not only do we have to identify the fracture bilaterality, right side, left side, but you're going to have to document the healing, the phase. So whether it be a closed or open fracture, number one. So if it is an initial encounter of a closed fracture, the extension is A. For initial encounter of an open fracture, it's B. And then we have additional extensions that are used for subsequent encounters for a fracture that has routine healing, delayed healing, a non-union, or a malunion. Okay? And so if you're in orthopedics, you're going to have to know all of these, and then the provider is going to have to indicate that within their documentation for the coders, so the coders will be able to code to the highest level of specificity. So, for example, in fractures, this would be a code used for the fracture. So this would be S42.321A, which is a displaced transverse fracture of the shaft of humerus, right arm, initial encounter for closed fracture. Okay? And so the A is telling them that this is the initial phase of treatment for a closed fracture of the transverse shaft of the humerus of the right arm. So the question is how do we get started? I mean, what do we do here? The first thing that I want to make sure everybody does is make sure you have a coding book as soon as possible. Now, the American Medical Association ICD-10 book, and it's still called the Draft Code Set, is probably the most comprehensive. However, for me personally, it's my favorite book because it gives us everything. Now, obviously, if you're a specialist and you don't really need a big giant coding book for all 68,000 codes, and you're looking for a specialty coding book, you can certainly purchase an industry-specific book for your type of specialty, and they're fine. Just make sure that any coding book you purchase will give you indication of whether you're supposed to code to the what the highest level of specificity is. And the AMA coding book very clearly states you code this to the 7th digit, you code this one to the 6th, and so on and so forth. Make sure it also gives you your excludes 1 and excludes 2 rules and the coding conventions for your particular codes. The coding conventions meaning the coding rules. So Yeah, and when I say coding book, I'm talking about either a paper book or online. And there are some good online resources. The AMA code book is available for a download. It has a great search feature. It's a little expensive. It's about $200, but everybody in your office can use it. So uh, sometimes that would be the best way to go. However, you can get I know AMA right now, their coding books are about $60 for the great big comprehensive ones, because they're already phasing out the 2015 and coming out with the 2016 edition, which is no different than the 2015. So you'll be fine if you buy the 2015 draft set. And the reason why they call it a draft is because the actual ICD coding system is not in implementation yet. It will be removed. The draft will be removed on October 1st. But it is the coding book. You just have the word draft written across the pages of the book. I also want to encourage you to go to the Medicare website, www.cms.gov, and you can type in the keyword search ICD-10, and it is going to give you a wealth of training resources and other resources for ICD-10. It also has mapping software, which is called the GEM, or General Equivalence Mapping. We'll be going into that a lot more next week when I talk to you about mapping your codes. But yeah, the Road to ICD-10 has webinars, and all of it is free. It is probably one of the best free coding resource areas, bar none. I really haven't come across anything that's much better than the Medicare Road to ICD-10 system. It's wonderful. So for those of you who would like to get much more coding experience and much more familiar with the ICD-10 codes, what we're going to be doing is a kind of a 4-hour overview of all of it. So we're not going to be able to get too in depth with the actual coding. When I teach, I'm right now, like I said, I'm teaching for Practice Management Institute. Their coding series is 18 hours of coding. It's a 6-hour transition workshop dealing with the transition of ICD-9 to ICD-10 and all of the operational systems. Then we have a 6-hour introduction to coding, and then we have another and coding workshop, and then we have another 6-hour coding workshop on top of that, the intermediate coding. So there's no way I can get through all of the information that you may need to know in order for you to feel completely comfortable with ICD-10, but I do want to point you in the right direction. So the Road to ICD-10 will help you. There are also other, go to your state association website. Go if you belong to a specialty organization such as the American Chiropractic Association or the American Association of Family Practice. When you go to those websites, they have free webinars on coding for your specific industry. And I also will be sending you, as I come across opportunities for webinars, I will send you those opportunities, but I'll forward them to all of the clients, and you can use those opportunities to learn more about ICD-10 coding. And then between now and next week, what I would like all of you to do is to start gathering up your hit list, what I call of your favorite ICD-9 codes. And this way, as we do the mapping workshop next week, you can actually use your own codes and use the rules that we talk about in the workshop next week to start mapping your own ICD-9 codes over to ICD-10. And then as you do that, it will help you understand better the increased level of documentation that you're going to need in order to justify those codes. Because we'll talk about this, you're going to have to remember that that every code that you put down on a claim form must be justified in your documentation. So now that you have to code laterality, for example, you're going to have to make sure your documentation clearly specifies that laterality as well. And so, and maybe stages of care, phases of healing, all of that is going to have to be documented when indicated. So let's make sure that we start thinking a lot more specific. Even now, as we're coding ICD-9, get into the habit of being more specific with your documentation so that it's not such a stretch come October 1st. I mean, we're only 2 months away, so we really, really need to get on the ball with that. So next week, we're going to be going through the coding rules and conventions for the general coding rules and conventions. We will start talking about how to map codes and actually do a little bit of a coding workshop with you so that you can all sit down. One of the things you may want to do next week is get with your staff, gather in front of the computer with your coding books, and we can actually talk about, mapping some codes and learning how to do that. And if you want to, you can send me some of your favorite codes, maybe 2 or 3 of them, and I can pre-map them and we can then discuss those in class next week. Our next class is going to be July 31st, next Friday at 12 o'clock Central, 10 o'clock Pacific, 11 o'clock Mountain, and 1 o'clock Eastern Time. So with that in mind, I would like to open this up for any questions. Now, we do have a few, let's see. We have one question. Okay, so this is actually a good one. Ida, who is the coder and actually the co-owner of Jones Chiropractic in Tennessee. She says, I may be jumping the gun here. If I am, let me know and I'll wait. What is the current ICD-9 code for decreased range of motion? We've been using 719.5, and now that I'm testing different scenarios given to me by my Blue Cross, I'm having trouble finding the appropriate ICD-10. The mapper isn't recognizing 719.50, and that is absolutely true. So what happens is some of your codes are not going to map because you're going to either have a combination code now, or you're going to have you're going to have to add additional information with your coding. So Ida, let's bring that actually to the next week's class, and we'll talk about how we use our words to find the correct code and the correct coding combination. Okay. Do we have any other questions? If we do, please go ahead and come off of mute and, feel free to ask your question. That's what I'm here for right now. We have about 6 or 7 minutes to do that. And I do want to remind all of my billers and my Gold Star reps, please stay on the call, and we'll have our little staff meeting at 1 o'clock. It should only be maybe 15 more minutes, okay? But if you have some questions, go ahead and raise your hand or speak out. Do we have any questions? Okay. If you do have questions, and it's maybe more specific to your own particular situation and you don't really feel like you need to share it with everybody, go ahead and send me an email and I'll be happy to, look at your questions and answer them. But if you do have a question that you feel might benefit everybody, please feel free to speak up. Otherwise, this will conclude our webinar, and I hope to see you all back here next week at 12 noon Central Time. So thanks, everybody. Okay, billers, why don't y'all, you can all come off mute. Let's make sure you don't have a lot of noise, background noise going on like TVs or